Good afternoon. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and I'd like to welcome you to the second installment of the 2021 Health Equity Forum. Thank you for joining us today. In recognition of Women's History Month, today's session features Dr. Vivian Pinn, a pioneer in women's health, a medical history maker, and an esteemed health leader. Our conversation with Dr. Pinn will focus on her historic career, her leadership experience and lessons learned, and COVID-19 and health disparities. Before we begin, just a few housekeeping items. All participants will remain in muted mode and off camera, and we will have time set aside for a Q&A with Dr. Pinn, but if at any point you'd like to post a question, please enter it in the Q&A box. Today's chat box will be disabled for participants. Now, for those of you who may not be familiar with the California Black Health Network, I'd like to start with just a brief overview. Next slide, please. The California Black Health Network was founded in 1978, had its first statewide conference in 1980, and expanded to 6 chapters and affiliates across the state shortly thereafter. It was incorporated in 1983 as a statewide organization and as a 501c3. And just a couple of notes in terms of claim to fame and accomplishments over the years. It was very instrumental in creating the Office of Multicultural Health here in California, as well as being the co-founder of the California Pan-Ethnic Health Network, otherwise known as CPHEN. Next slide. We are the voice and trusted resource for Black health equity in California, and also the only Black-led statewide organization dedicated to advocating for health equity for all African Americans and Black immigrants in the state. Next slide. Our vision is to create a California where every African American and Black immigrant has the opportunity to live long, healthy lives free from violence, racism, and health inequities. And our mission is to ensure that all Black Californians, really regardless of their education, how much money they make, where they live, what their sexual orientation or gender identity is, or immigration status and the like, has the opportunity to live a high quality, has access to high quality and equitable primary health care and behavioral health care, and really live a long, prosperous life. Next slide. And so today, again, we have Dr. Vivian Pinn. She was the inaugural full-time director of the Office of Research on Women's Health at the National Institutes of Health, or NIH, from 1991, and associate director for women's health research from 1994 until her retirement in 2011. Under her leadership, the office led the implementation of NIH research inclusion policies for women and people of color in clinical research, developed the first ever, as well as subsequent national strategic plans for women's health research, and established many research funding initiatives and career development programs. She also established and co-chaired the NIH Committee on Women and Biomedical Careers. She has presented her perceptions of women's health and sex and gender research, health disparities, as well as challenges in biomedical careers to national and international audiences, and has served as a mentor to hundreds of young women and men of all races. Dr. Pinn came to NIH from Howard University College of Medicine, where she had been a professor and chair of the Department of Pathology. She was the 3rd woman in the US to hold such an appointment and the first African-American woman ever. Dr. Pinn also held teaching appointments in pathology at Harvard Medical School and Tufts University, where she was also Assistant Dean for Student Affairs. Dr. Pinn has received numerous awards, over 300 awards and honors over her 30+ career, including 17 honorary degrees of science, law, and medicine. She grew up in Lynchburg, Virginia, my home state, where she was educated in segregated public schools, but then went on to pursue an undergraduate degree from Wellesley College and her medical degree from the University of Virginia. I could go on for days about Dr. Pinn's career and accomplishments, but we have the opportunity today to hear more directly from her about all of that. So it is my honor and a privilege to introduce to you Dr. Vivian Pinn. Welcome, Dr. Pinn.
Thank you so much, Rhonda. Thanks for inviting me to be with you. It's really great to hear about the Black Health Network in California and the work that you're doing. So I'm pleased to be with you.
Thank you very much. And so I want to start by digging back a little bit into your history. And you went to Wellesley back in the 50s, and you went to UVA Medical School and graduated from there in 1967, where you were the only person of color and the only woman in your class. I should say the only Black person and the only woman in your class. So what was that like in both of those experiences for you, especially during that time?
And it was the only person of color because there were 70-something white men and me. It was an interesting experience. Having come from Lynchburg and graduating from Dunbar High School, which was the Black high school because our schools were segregated then, and getting to Wellesley, which was all women, and finding there were 4 of us of color in the first year class, 3 of us who became close friends, and one who I think wasn't quite sure that she was Black, although we all did know that she was. But it was an interesting experience. I did get to meet and really found friends among the other students, but it was the 3 of us out of the 4 who really formed long-lasting friendships and relationships that have lasted over the years. But I had some very supportive friends and actually eventually a roommate whose son eventually became my godson, and who to this day has been a great supporter and introduced me in so many ways to things that I might not have had occasion to experience. For example, her mother was married to James Ramsey Ullman, who was an author who wrote Tiger of the Snows about the exploits of Mount Everest. And my mother died during my sophomore year at Wellesley. And at that time you did your papers over holidays. And I needed to work on a paper over the Christmas holidays, and I needed access to books. And I had my father check to see if I could check books out of the city library when I came home for Christmas. And he was told, no, I could not. So I asked him to ask the high school librarian to check with the colleges in the area. That was Lynchburg College, Randolph-Macon, which was co-ed at that time, in Sweetbriar. And all 3 of them said, no, I could not have access to their library, nor could I have someone check books out for me, obviously because they were segregated and I was Black. And I was at a loss. I just lost my mother. We didn't have a lot of money to spend on books, but I was going to have to work on these papers, and I wasn't sure how I was going to work on these papers. And I got an envelope one day before the holiday, and it was from the stepfather of my college roommate with a note saying, use this as my token against segregation. And it was a check for $75 to buy books. Well, in 1960, 61, $75 was the equivalent of a huge amount of money. And I just like to recall that story because it was a token of some of the unexpected support I got from some of my other classmates, although there were others who only knew Blacks through their maids and their housekeepers. Getting to UVA was completely different experience. I'd been at Wellesley, which was all women. That was after Dunbar, which was obviously a co-ed high school. And I get there and I'm on the first day and I'm sitting in the back of the classroom waiting for others to come in. And so far, I only see the white guys in the class, and I figure the women and the other people of color must be late for once I was on time. And then the dean called the roll, and all of a sudden I realized that everyone was there and it was going to be me and this class of all white men. And that was quite an experience. And I had some very interesting experiences, some of which I tell and some of which I don't tell, that took place during my 4 years at UVA. But I'd like to say that those experiences, I hope, made me stronger, even if a little bit crazier.
I'm sure you could write a book or two about your experiences there during, especially during that time. Now, so you talk about, so probably you alluded to some of the good and bad experiences there at UVA. But since, fast forward 30 something odd years later, you now have a building named in your honor at the medical school, and also one of the medical student colleges. So what is your perspective on that? And what does that mean for you in terms of leaving a legacy?
When I was told that they called to ask if they could use my name, and I didn't know what it was for, and I was at NIH at the time, and they got permission, but I didn't know what it was about and how it came about. And then I learned that one of the medical education buildings, the largest one, in fact, the medical and research building, which had previously been named for a eugenist, and I think because of student unrest and concerns about buildings on the campus being named for those who've been very active in the practice of eugenics. And actually, I'm so glad I didn't know that when I was a student there, because I probably would have been very concerned, thinking I was walking the hall being viewed by some who believed in the eugenist theory. So I was really quite overwhelmed and really touched, and I wasn't sure how to react. I really felt humbled. But the thing that struck my mind, first of all, was that my very first trip to UVA that I could remember had been in the early 50s, when my grandfather had been a cancer patient at UVA. And I can remember he was on the black ward, as it was called, the segregated ward, which was on the ground floor of the old UVA hospital. And I was thinking, since I used the same name as my grandfather's name, Pinn, I can remember where his room was, and was by a window. And as you looked out, you would look across out at Jefferson Park Avenue. And I thought, looking out of that window where my grandfather was in that segregated hospital ward in the ground floor, the basement floor actually, of the hospital at UVA then, I wonder how he would feel if he could today look out that window and see his name and our family name on a building. And that really brought me a great bit of family pride. But I realized I should not take this as just something for me. It was not just a personal honor. And I realized that, I could stand there. In fact, I have stood there right in front of the building with my name on it. People have no idea who I am. And so that's great. I don't have to stand up and say, I'm Vivian Pinn, this is Pinn Hall. But what to me it signifies is that for years to come, there will be people of color who recognize that UVA did signify significance to a graduate who was not the traditional graduate, to a Virginia Black woman who struggled to get through medical school and who did complete medical school. And in spite of what I went through, and I was not the top student in my class, it was work for me to get through, but that they recognize someone that maybe they can identify with. So while to me, yes, it's a personal honor, I think in terms of the broader world, it's really a legacy for others to appreciate and to be honored by. So I don't take it all just in my head and for me, but it's the significance of renaming that building and taking the eugenist name off and naming it for a Black woman whose grandfather had years before been on the segregated hospital ward.
That's great. And so I'm sure a lot of the lives that you've touched in your professional career look to you as, someone who really paved the way for their success in their career as well. So, and something to look for or look up to. And so you were the inaugural first time or full-time director at the Office of Research on Women's Health at NIH. And you are a pioneer, really, of women's health research. So I'd like for you to talk a little bit about that, but I'm really curious about how, you kind of alluded to this. So how did a little girl from Lynchburg, Virginia, from a segregated public school end up like having such a stellar career and end up being, the inaugural director of the Women's Health Research Division at NIH?
That was an opportunity, one that I would never have dreamed of. I never thought about being in government and policy, much less in a position that got so much media attention, congressional attention, but most of all, to be in a position where maybe I could make a difference, not just for some women, but for all women. I have to go back and think, growing up, I have to give a lot of credit to my family, to my mother, even though she died when I was 19. But my mother and my father, who were school teachers, but who really made me realize the importance of education, and who used to tell me, because always said I wanted to be a doctor. They tell me since the age of 4, when I said I wanted to be a pediatrician. I think they used that really to control me, because they'd say you have to behave and you have to study if you want to become a doctor, so they could use it to control me. But on the other hand, they never said to me, I mean, I was born in a home, and my mother's home had no running water, no electricity, and I was born on a farm down in Halifax County, Virginia, and to all of a sudden be in the halls of Congress and traveling internationally with government leaders. What a transition that had been in my life. But I have to think that the credit goes back to those early years, because there were no physicians in my family. There were no researchers in our family. And I have to give credit to my parents, because they never once said, you'll never be that, or you can't be that. They just said, if you want to be a doctor, you've got to study hard and put your mind into it. And you've got to do this and you've got to do that. Not putting pressure on me to do it, but reminding me, if this is really what I wanted to do, that I was going to have to prepare for it. Never once saying, because we don't know any Black women doctors, and because, we don't know anyone like you want to be, saying, and, we're from a poor family, and, you know, that this is not something you can dream about. They just said, if you want to do it, you got to work hard and you got to study. And that was it. So they really gave me the mindset of the preparation, because they never made me doubt that I could be what I might want to be. And getting into that transition from finishing medical school, because I promised my mother before she died, because I actually took time out of college. I took a leave of absence to take care of her during her terminal months, actually. And I promised her I would go on and become a physician. And my mind was set more on being a physician. And then the opportunities I had after that, and then to be invited I did not apply. I was actually invited to come to NIH to lead this new office. And to me, it was something greatly important, because I'd always had concerns about the health of women, especially after seeing how my mother was treated as a
Right.
patient when the doctor paid no attention to her and missed her diagnosis. She had bone cancer. He was treating her for bad posture. And I realized even back then, while I was still a college student, doctors need to listen to their patients and not feel they're on high, dictating what we should know about ourselves. And so having an opportunity to do what I've been giving attention to all my life on my own time, that is the health of women, the health of people of color, was really a great opportunity for me. And I cherished it. And I went there thinking, I've got to remember to make a difference for all women. I couldn't dream of being the head of an office of research on women's health, because it didn't exist before that. This was a new concept. It was a
Right.
new area of research. It was a new focus. And so I had a lot of responsibility on me to get this accepted as a true scientific pursuit, but also to have women and members of our communities to accept what we were doing and go along with it. I have to tell you a little story. I have lots of anecdotes, obviously,
Yeah,
but
sure.
I was so excited about getting this new position. And there were a number of women of color who were at NIH, who had been at NIH for years, and whom I had a great deal of respect for and liked. And they invited me to come to dinner one night just before I started. And I thought, well, this is nice, going to be a nice social dinner. They're going to congratulate me for being in this position. And I got there and they said, welcome, Vivian, sit down. And then they proceeded to tell me that they were going to be watching what I was doing. And if I ever forgot who I was or what I was or where I came from, they were going to be on me. I never forgot that. What they said, I was actually kind of comforted that they really reminded me of that and that I knew they'd have them backing me. But I tried to carry that forward in everything I did. I never forgot, right up till the day I retired, who I was, where I came from, and that I was a woman of color.
Yeah. And that, like you talked about your parents in this group of women, like, whenever we achieve success, we're not in it alone. Yes,
That's right.
there's something within us as individuals in terms of perseverance and tenacity and all that, but we can never do all of that alone. And it's always great to have support. And so, one of the things I think that you're known for is really changing the perspective on how women's health has been viewed, and looking at it more than just reproductive health. So can you talk a little bit about your perspective on the evolution of women's health and your, ideas back then?
Well, when we first started, I had to really, when I'd be talking about what we were doing, I'd have to start with what is women's health and why is it important to address? Women's health had traditionally been seen as the health of women during the reproductive years. And what was women's health? It was reproductive organs and breast cancer. That was it. And most, in fact, almost all the research on women had really been related to the reproductive system or to breast cancer. And there was not a lot of research even in those areas. And for example, having come from Howard to NIH, where we had seen so many patients with fibroids, uterine fibroids, to realize there was no research being funded on uterine fibroids or endometriosis, which we knew was so common in women of color. But the point of the office and what really brought it about was that recognizing, and at that point, many women were not aware of the fact, and I would even question physicians and medical students and nursing students and found it was really not widely recognized that the leading cause of death for women in the United States was not breast cancer, that was the most common cancer, but the leading cause of death is heart disease. It was and it is up until this pandemic, which is changing all the statistics. And yet very little research was being done on women. Most of the research on cardiovascular disease, heart disease, and stroke was being done on mostly white men. And so there were many questions about the diagnosis of heart disease in women. Is there adequate treatment or appropriate treatment? Are they getting the right tests? And so we had to really focus on other areas of women's health important for our longevity and affecting not only how long we live, but how healthy we are, looking at mental conditions, looking at musculoskeletal diseases, arthritis, for example, which is a chronic cause for so many women to not be mobile as they get older. Urinary incontinence, which many don't recognize, is one of the major trips that have women end up having to go into nursing homes. And so we had to justify and convince people to recognize, pardon me for my voice, I'll get a sip of water in a second, but that women's health encompasses more than the reproductive system, and it encompasses more than just our reproductive years. Remember back about 1990 when this office was set up, once you hit menopause, you were sort of not looked at as a woman. You were expected to maybe sit in a rocking chair on the front porch, and that was it. And look at today, women who are, I won't even say how old I am, but my age or around my age or even younger than I am, who are years past menopause, are CEOs. They're playing tennis, they're leading companies, they're leading their communities. And so we knew that we needed to look at the health of young kids, of teenagers and adolescents, so that we could see healthy women in their postmenopausal years. And that was the major theme we had to address. And many felt that this is just being politically correct to put women in clinical trials and that to study women. And so we had to show that there are differences. For example, heart disease may present very differently in a woman than it does in a man. So when a woman comes into the emergency room and she's complaining of maybe not that sharp pain in the left side of her chest, but what seems like indigestion, that it needs to be taken seriously and evaluated for possible heart disease rather than being told, go home, make up with your husband, and you'll be fine. And let me just take a sip, pardon me. I have allergies and it's that season here.
Oh, no, no, no worries. I know I know it's springtime in DC, so I know exactly what you mean.
I hope
So
that's
yeah,
better, a little better.
yeah,
Yes.
yeah. So I know, so you've seen a lot, you've done a lot, but what is the one thing that you're most proud of in your career?
Oh, when I think about my career, and I've had lots of honors and I've had lots of opportunities, but, and this may sound strange, but it really is how I feel. I'm one person and I've had some great opportunities, but I'll be passing on and I'm moving on. And to me, my greatest accomplishments are having been able to give opportunities to young folks coming behind me, to be able to mentor or give advice or just provide that support to so many younger people who I may have been able to get admitted to medical school or provide support for or give career advice to, and seeing how they have accomplished such wonderful things. So my pride in my life is where my legacy, I hope, will be is in the accomplishments of those that I've taught or mentored or known through my years of life. Sounds strange, but it really isn't. That's really how I feel.
Great, great. So I see there are no questions in the Q&A box yet, so we'll continue on and hopefully we'll get some shortly. So I want to move into your leadership experience. And so before you retired from NIH, you led a national initiative to re-examine priorities for the women's health research agenda and involving more than 1,500 advocates, researchers, scientists, policymakers, educators, and so forth from across the country and probably internationally too. So what your vision for 2020, right, in terms of the women's health research, kind of continued on after you retired. So what was the outcome of that initiative? And, how has that become a reality since your retirement?
Well, the office is continuing to build on that research agenda. We actually had several research agendas that we did, and that was the last one looking towards 2020, which we sort of thought in terms of 10 years worth of priorities and moving forward. What I thought was most significant about that process and what we did, more so perhaps than just the specific research topics, was I think I took a lot of my own experiences before I went into government. Remember, I had been practicing pathology for 25 years, and I did not grow up my career or my opportunities in government. I went to government sort of cold in when I went in 1991. But I remembered so many times when I learned that NIH or other government agencies were looking to address issues related to women or issues related to people of color. They would ask for submissions of thoughts and they would hold public hearings. And I would work on some document and what I really thought. And I never saw it again. I never heard anything related to it after I'd given it so much thought. And realizing also after moving from Boston to Washington, I was close to these government agencies, but when I was in Boston, didn't feel so close. And I would mention to people that I knew in other parts of the country, and they want to know what is NIH and what that's about. It realized there was not that connection. And I thought, this is important. This is something I can do. If we're going to put together a research agenda, a plan for how to address women's health, it needs to address the concerns of women, not just those who are here at NIH or those that are here in Washington have access. We need to reach out to communities across the country so that people can feel they have some input into what we're doing. And so we can hear from not just the top scientists, not just the top researchers or physicians, but from the everyday woman or man or a teenager or older person about what their health concerns were to make sure that our priorities were in keeping with what was needed from the individual woman's perspective. And so that's why we held these workshops across the country. We had public hearings. Anyone could come to testify. They just had to notify and sign up, and they couldn't talk longer than 7 minutes, and they couldn't submit more than maybe 10 pages or something like that. We had a limit because we didn't want books and chapters submitted to us. But we learned so much and identified so many women out in communities across the country, women and men, to be honest about it, who were involved and who had great ideas and that we brought in to work with us as we went forward. But I could at least feel that the document we were preparing represented what women wanted to know and needed to know, and they have some ownership of what we were doing. And it takes ownership to really support
Right.
these programs and to make government programs work. And I thought that was probably the major significance to about having this large input and going to people rather than expecting people to come to us, just as we talk about for clinical trials, just as we talk about for healthcare. If we're there
Right.
for the people, we need to go to the people.
Mhm.
And that was one of the things that I wanted to do. And I
That's great.
think, we built a comprehensive agenda on everything from behavioral health to looking at organ systems to even more for reproductive systems, from mental and spiritual well-being to careers and understanding how to promote careers. And that sort of provided a basis for what the office has built on. And I'm proud to say the current office has really expanded those priorities that we set back now over 10 years ago.
No, we thank you for all of that work and your vision and foresight to make that happen. And so obviously you've had a successful career, and you did that during a time where, there were not a lot of women in leadership, and definitely not a lot of women of color, and definitely not Black women. And so I'm sure between, going through medical school and being in a very male dominated profession, that you were met with a lot of challenges and maybe in some cases, I'm sure, just based on the times, racism as well. So what do you attribute to your success and your ability to transcend above all those obstacles and maybe sometimes even barriers that were in front of you?
Well, I've thought about this and I get asked that question a lot. And I was talking with Barbara Starks Vavassa, who was in the class ahead of me at UVA and actually was the first Black woman to finish, well, actually to be admitted and to finish medical school at UVA. And I was telling her that I was being asked so often, how did we make it through? Kids wanted to know today who were medical students, if we're finding all these problems now, what was it like for you back then? And how did you make it through? And I said, I'm having difficulty trying to explain. And she put it in very simple terms, which I've repeated since because I don't think I could say it better. She said, just remind them that we were there with a goal. Our purpose was to get a medical education so we could practice medicine and do for our communities what we wanted to do in terms of being physicians. And so while we didn't take a lot of, we stood up to, and no, we were not patsies. We didn't take, and we stood up. And I think I was much more outspoken than Barbara was. She's a very lovely, gentle person, but in her own way, I think we both did. We had to also recognize that we could not let, and this was not only in medical school, but in other positions I was in, because believe me, there were not a lot of people happy that a Black woman was leading an office of women's health. It's all right if you're leading an office of minority health or minority women, but they weren't expecting to see a Black woman leading an office for all women. So believe me, I have met challenges all along the way. But I always had to remember, in essence, what Barbara summarized, which was keep my eye on what I'm trying to accomplish and don't let, you stand up for yourself and you stand up for what you're doing, but you don't get so distracted that you don't get to reach your goal. You can't get so embroiled in all the battles that you forget your academics or you forget your office or you forget your programs. You've got to figure out how to battle those isms, those sexism, racism, whatever the isms
Right.
are, and at the same time keep moving forward so that you're not pulled off your path to success. And that really, I think, is what has guided me through all the years. She just said it much better than I could have.
So otherwise known as keeping your eye on the prize, right?
Exactly,
Yeah.
exactly.
And so what other lessons in leadership did you learn from your career?
Well, I think you stated something earlier that is truly something I believe, and that is that really good leaders don't get where they are just by themselves. And And that mentoring, although we didn't always call them mentors, I don't think we called them mentors back in my early days. Eventually you learn to call them mentors or advisors or sponsors or whatever, but that a really good leader has good advisors, good mentors, and knows how to bring in and support those around them. And that to me has been extremely important. I think one of the reasons that I put so much time into mentoring was because in medical school, and everybody talks about women for mentoring other women. Well, there were no minority faculty, and there was only one senior woman faculty, and she had no use for me or the nurses, and we were the women at the school. She had no use for us. So I really didn't have anyone I could talk to. So I would go home. I'd drive home to Lynchburg from Charlottesville, and my father didn't know about being a physician. He was not a physician, but I could at least explain and I guess sort of blow off steam and talk about some of these things. But it was the lack of having a true person that I could go to about sometimes when you're in a bind or you're in a what seems like a serious situation, just being able to talk about it can make a difference. So with that in mind, I think once I finished medical school and became a junior faculty person, whenever a student or colleague would come and want to talk, I might have been really busy, but I just felt I have to make time because this could have been me trying to get some assistance or getting someone to listen to me. So I believe in trying to make lemonade out of lemons. And I think my mentoring, as I've thought about it over the years, I think my strong emphasis on mentoring really comes about from that negative experience. Um, just knowing what I didn't have and not wanting to leave somebody else feeling that same way. I've also learned that you can't be a good leader if you don't know where you're leading. You've got to have something in mind. If you're a leader, you're working with others, and you've got to know where you're leading others as well as yourself. So you can't be a good leader without having that vision in mind for what you're working towards. And a good leader has to recognize that you don't get others to do the work and you take the credit. A good leader is actually leading others. And the best that a good leader can do is to develop those who are working with you. And remember that you need to promote those who are with you, not only give them ownership of the work, but also give them ownership of the success. I think those are two or three of the most important things I think about leadership.
That's great. And so the one thing that I think is important about what you just said relative to mentoring. So you may not have had official mentors, throughout your career, especially early on, but what you did have is so important, and that was a safe space or a safe place
Yes.
to go, right? And that was home to your family. And so regardless of who we are, what we do, I think having a safe space or a safe place to go or a go-to person is definitely important, and especially considering all that we've been through over the past year, being sequestered at home, some of the things that we've bared witness to that may not have always been a positive experience. Yeah, I think that's a part of what we need to do to ensure our own mental health and well-being. So thank you for saying that. So we do have one question in the chat box. And so the person, Ernesta, wants to know, what specific advice did you give to those you mentored? And is there one thing that you haven't said that you felt you needed to do to ensure young adults and what they needed to know? So she has a comment. It's a blessing to see how your investment has impacted the lives of others. So thank you.
Oh, thank
So
you for that. It really depends upon the individual and the circumstance. It could have been related to personal issues, could have been related to academic issues, but I always try to be honest and to be positive. I think if I tell folks, if you're looking for a mentor, you want someone who's got your best interest at heart and who's going to be honest with you and give you positive advice. It doesn't help to have a mentor to say, well, I can see why you're interested in that position, but I don't think you can handle that. It would be much better to say, you know, I really can see why you'd like this, and let's look at whether or not you really think you can handle this, or maybe there's another position that would be better, that you'd be better suited for because you really want to be comfortable in whatever you move into. Sometimes just how that mentoring or advice is phrased can make a big difference. But I try to remember that you need to be positive if you're mentoring and advising someone, and you need to be honest with them. You shouldn't build false hopes, but you don't want to discourage anyone. And so I think being positive and being honest. There's nothing worse than having a mentor, which I've seen happen, who told students or told folks, yeah, that would be great. And then they write a recommendation with all of these qualifiers in it. So they don't help you get in the position because they doubted that you could do it. It would have been much better if you had known that that mentor didn't really think that that was the best position for you, but not just to say that's not a good position for you, but let's think about where you really should go and where your talents really are, and have that individual really make his or her own decisions, but helping to guide them to do that. I don't know if that makes sense, but that's sort of my approach.
Well,
And
I
it
think it's just,
depends on what
yeah,
people are asking about at the time.
right. And being honest and transparent in that relationship, I think is what
Yes,
you're really referring to. Yes, rather to know that upfront than have it appear like in a
yes.
way that wouldn't necessarily help you further your career goals. So, I think, we talk about having a mentor, and we also talk about having a sponsor or a champion. Can you talk about the difference between the two and why having both may be important?
Well, this delineation between a sponsor and a mentor has sort of arisen in recent years. So I'm not probably the best to ask about that, because the way it's viewed today is that a mentor is someone who advises you, and a sponsor is someone who helps you move ahead and helps you get into positions and sort of follows your career. So that's the current concept, and that's probably what you're asking about.
Yeah.
And so I probably shouldn't be quoted, but my view is students that I mentored in the 70s are still coming to me. I'm still writing recommendations and giving advice to those that I mentored in the 60s and the 70s and the 80s and the 90s. So to me, a good mentor doesn't drop off and a sponsor picks up. I see all of that as being the role of a good mentor, but I have to watch what I say, because even the National Academy has done reports and studies on sponsorship versus mentorship. But if you're a good mentor, you're not going to just advise someone and then drop them off when they go to move into looking at careers and getting further. And I can quote, for example, the numbers that I have been following and advising through various career phases now for what it's from 70 to 20, 30, 40 years. So I think that's my interpretation of being a mentor. But for anyone who doesn't and needs those two roles, fine. Just be the best at what you do and look out for the best advice and the best support you can provide for those you're working with.
Yeah, it's interesting that you say that. So I've had several mentors in my life, and one in particular, I started out in high school with her as a mentor, and she is still a part of my life to today. We're more friends, and we support each other and advise each other. But yeah, she's still a very prominent force of my life, and have collected a few others along the way. And I seek counsel from them for different things that I need to have sort of another brain or a thought partner on. So great. And so when we talk about leadership, and we have to acknowledge what's been happening over the last year when we think about COVID and the impact on our life here in the US. So do you have any thoughts or perspectives about the leadership and what may have been done differently relative to leadership with the COVID pandemic?
I have lots of thoughts, so I don't want to take up the whole hour with this, but a couple of points, and then sort of how I've summarized what some of the lessons we've learned from this pandemic. For one, the pandemic has really exposed to others, and it seems to be a surprise to them, something we have known all along, and that means that there are disparities in health and disparities in how health care is provided and even how health care is sought. None of us are surprised to know that we have a higher death rate, that we're having impacted more than other populations. Not a surprise to us. We've known that for years, but finally someone is seeing this, looking at the statistics related to the pandemic, and all of a sudden there is an awakening. So I won't criticize that, because maybe it unfortunately, the pandemic, it took to bring many to recognize that this disparity really exists, and that it's not just related just to healthcare, but that it's related to the social determinants of health. We've been
Yeah.
talking about social determinants of health for years, and all of a sudden it's a new term. Everybody's talking about it like it's a new concept that just came up. Well, we've known it, but the good thing is that at least it's beginning to be recognized. When the pandemic was just really at its height, well, I guess it's back at its height again now, but in the early days, and as I witnessed what was happening, what decisions were being made and how they were being made, the leadership at the very top levels, all the way down to institutional levels. There were discussions about how should healthcare change? What have we learned about the pandemic? And the first word that came to my mind was empathy. There was obviously a lack of empathy at the highest levels. This was being treated as a scientific problem, but not focused on the individuals, and how empathy was important in looking at how it was affecting the decision making related to how healthcare was being provided, how diagnoses were being made, who was going to get the respirator when there were limited respirators or ventilators, what was happening in terms of being concerned about healthcare providers and those on the front line. I saw empathy as the major thing lacking. And then as I began to give it thought, and just to summarize it, bring it down, I ended up with what I've called VP's 4 E's, the 4 words starting with E that I
Okay.
think are important. First, of course, is empathy. The second, of course, is equity. Equity in not just favoritism in terms of who's being provided with. Before it was testing and support and hospital beds, et cetera. Now it's in terms of looking at the vaccine and how that's being distributed. Though equity still carries a strong influence in this pandemic area, and what we need to develop as we move through it. Third is a sense of ethics, because sometimes the decisions that are made, to me, just have no ethical basis, and somebody's lacking something in terms of a sense of ethics when they're making some of these decisions that are made, in information that is shared or not shared, or how healthcare is being provided. And of course, fourth, you always need excellence, everybody to be the best they can be. So those are my 4 E's. And I think it was applicable to how COVID was being detected, to testing for COVID, for providing supplies for those who were dealing with it in the health area, providing supplies and protecting those who were the front, the first responders, from bus drivers to those who were cleaning the buildings and the hospitals, those working in the grocery stores, those taking care of those with COVID, and how it was affecting families and those who were not going for tests because they didn't want to know if they were positive, because they couldn't afford to stay home, if they were positive because they were worried about their income. And then, of course, and then now looking at what's happening in terms of vaccine. And we hear a lot about vaccine hesitancy, and I'd like to change that to vaccine urgency. Those who have gotten the vaccine, have had access to the vaccine, just seem to get a whole different aura, feeling they've got some degree of protection. And what do we need to do to get those who are concerned about the vaccine or getting the vaccine, those in the category of vaccine hesitancy? We need to transition those to vaccine urgency. And that was how I felt as a member of the public, since I'm not directly connected with the hospital and I had to go through that public line to get an appointment. I was really feeling the sense of urgency. So I knew what others like me were experiencing, because I was like a member of the public. But boy, that sense of urgency, once I got that vaccine, it was such a relief. It may not totally protect me, but I can at least feel a bit more protected. And I just would like to see more people have that same sense of relief.
Okay, I'd like to talk a little bit more about COVID-19 and the vaccine, but I want to get to a couple questions first. So Monica wants to know, she said, you've seen so many changes and have had amazingly contributed to these changes that we see in healthcare today. But what are the areas of change you would like to see in the next generation of students going into medicine to advocate for and focus on?
First of all, more diversity. We've done a good job of bringing more women into medicine, and today about 51% of those who are applying to medical school are women. So while I'm a big women's health advocate, we still need to get more women into medicine. But the focus now and the major challenges for women in medicine is getting into leadership positions. We've gotten them to apply and to realize they can do medicine. They're excelling in nursing, and I'm understanding that some nursing schools have got a higher applicant pool per space than even for medical school, because people have appreciated I think all the PR and seeing the value of nurses and all of those who are contributing to healthcare. So for women, we want to continue to encourage women to come into medicine, but we really have to do more to help advance women, especially women of color, into leadership and decision-making positions. But diversity, we have not done well on. And while I'm a big women's advocate, I have to point out the fact that we was recognized just a couple of years ago that while we were pushing for more diversity, Black men were being left behind. And if you looked at all people of color, men and women, it was Black men who had fallen so far behind. In fact, as the numbers of medical students had increased, the percentage of Black males had actually decreased. Within the last couple of years, as this has been recognized, there's now more attention to getting Black males into medicine. But a few years ago, we called it the crisis, really the crisis of the Black male in medicine, because we want to see more Black males coming in. And what are the factors that contribute to that? And then looking at other, not just those who are Black, but those who are from other ethnic, underrepresented in medicine, we call them URIM, underrepresented in medicine groups. Many of them also are really low. If you look at the percentage of faculty and the percentage of students and take all underrepresented in medicine groups, it's about 13 or 14%. The last 10 years, it's only increased maybe 1 or 2 percentage points. Well, we don't all have to have a doctor that looks like us to take care of us. And we all have had that experience with doctors who were different than us. But it has been shown, going all the way back to that Margaret Heckler report from 1984, that for many, especially those who are underserved, they are more apt to open up and feel more free to express some of their concerns, especially when it comes to social determinants of health, which may be affecting their health and their status, if they're speaking with or seeing someone as a healthcare provider who is similar to them. So we've known since the mid-'80s that it's really important to have a diversity of healthcare provider, but that doesn't mean that everybody who's Black has to have a Black provider, but it certainly helps to have more Black providers available, not just in family care or general practice, but in specialties too. So diversity of both women and those from underrepresented groups are important. Secondly, it is important that we do more to provide access to healthcare. It doesn't matter if you've got the best trained specialists at the major hospitals in your area, but if you can't get access to that attention or get access to their diagnostic acumen or diagnostic to their treatments, which are state of the art, then it's not really doing you or me any good. And that means also overcoming some of the financial barriers. And those financial barriers affect not only those that go into healthcare professional schools, but also those who have access to health professional care. So I think diversity of the providers, looking both at people of color as well as women, having access to healthcare, equal access or better access to healthcare, and finally overcoming some of the social determinants of health and especially with that, the financial input. And I guess I have to point out something that is now being seen as another pandemic, really based upon all the protests we've seen, but as it also relates to what we've witnessed with this pandemic, and that is racism. Certainly, I think we've kind of shied away from referring to racism, but you can't be denied anymore. And when we're seeing not only those in medicine and healthcare, but in education and others talking about structural or systemic racism, we've got to consider that we've got to overcome racism as it can affect everything from the child who's trying to survive, much less get admitted into educational programs, professional educational programs, as to how decisions are made about giving health care to surviving and being a provider. Uh, that's something else that has really been perhaps a positive thing out of this pandemic. Not a lot of positives, but all of a sudden people are recognizing racism may exist, as though they had no idea it really could still be around when we've been experiencing it all along. And the fact that it's beginning to get attention, but the bottom line is we'll never overcome. Everybody's talking about an anti-racist society, which we want to address, and anti-racism institutions and hospitals and medical schools. But if you can't get folks to admit that racism exists, then you're never going to be able to have an anti-racist agenda. I didn't mean
No,
to go off of my soapbox,
no,
but
no, no,
that
that's
has to
okay.
be brought up.
I kind of, we talk a lot about racial bias or implicit bias and how that exists within the healthcare system. And, I kind of liken the process to, although I've never been through it, but, AA, first of all, to your point, you have to
Yeah.
admit that you have a problem and then
Yes.
be willing to want to do something about it and go through that whole process and transformation to end up on the other side of not being, um, an alcoholic anymore. So how do we get people to not being, first of all, recognize that they may not be a racist, but I
Yeah.
think to some extent we all exhibit some form of implicit bias. And just, being able to recognize and own that and embrace it and then want to do something about it is, I think, a good starting point. So thank you for bringing that up. So we do have a question from an anonymous attendee who says that Warren Buffett said the biggest decision of your life is who you choose to marry. What advice do you have for those in choosing a work-life balance that is career driven? And, what's been your experience? Because I know you have been married. And do you have any advice for how it can be done? When they say women can have it all, like, what's the secret sauce for that, right?
I'm not sure my example of work-life balance was the best work-life balance, but I did the best I could. I'll just make one point about my own, and then I'll talk about the advice that I give, because this is the topic that so many young women, I don't hear this question from men so often, but it's probably one of the top questions from young women who are either considering careers in medicine, healthcare, or who are already in medicine or healthcare. Can you have a family and be a physician? Can you be successful? What about work-life balance? I like to think of it as not so much balance as work-life, what's the word I want when you compromises, because it's going to take some compromises. I came through at a time when women in medicine were often asked, do you plan to get married and do you plan to have children? And many times they were excluded from certain training programs because if they said they were planning to have children, the men, and they were mostly men doing the interviewing, felt they wouldn't be able to give their total mind to their positions. And fortunately, we've gotten past that, although every now and then somebody tells me they've been asked a question like this. I think it's considered illegal. It certainly isn't proper to ask those kind of questions today. But I'd like to look back and yes, I am divorced. I tried. It didn't quite work out, but we're still good friends today. And I guess that's, well, no, I'm not going to go into my person. We're still good friends, and he was a physician, but we just had sort of battling careers. But I still love him. That's another story. But in terms of advising people, having just done a whole seminar on this a few days ago, it is possible, and it can be done, and it will be done. I remember I was in a conference, and this was maybe back when in the mid 90s when our office was new, and of course careers was part of our responsibility, our mission statement. And I was in a workshop on women in biomedical careers, and we were talking about the impact of child care and family care on the careers of women in medicine. And I was talking about how it needs to be shared, and you need support and hope it be shared. And at that point, and maybe more so today, although not totally, men were beginning to spend more time helping. And I remember this woman who is a leading scientist today. If I called her name, you may well have heard of her. I won't embarrass her by calling her name, but she put her hand up and she said, and she was serious. She said, Dr. Pinn, the government needs to tell women to only marry men who are going to help them with child care and family care. And I had to respond, that's a great idea, but I don't think government can dictate who you fall in love with or who you marry. So my advice is when you're making those decisions, recognize it can be done. It helps if you have someone who understands that you have a commitment to career as well as a commitment to family. And even if it's not having children, just to life being more than just your career, it helps. And you should have that discussion before you make a commitment to be together, so you got that understanding. But that women, even back in there was a woman who's my age who had 4 children, and this was back in the 50s and 60s. She had 4 children by the time she finished medical school and had a fifth afterwards, had a successful marriage, successful family, and a successful career. So it has been done over the years. It's a matter of mindset and who you're working with. And you just need to try. Doesn't always follow through because it's not always the same once you're really experiencing it, as opposed to what you're expecting to experience. But the important thing is, don't give up a career in something you want to do, be it medicine, be it law, be it banking, be it whatever you want to do, because you fear that it will interfere with your having a successful family life. Just know that it's going to take some compromises here and there. Nothing will be perfect, but even those who have no family responsibilities or those who have no career and only family responsibilities, it's not perfect for anyone, but don't be discouraged. It is possible to do, and most have really made it work.
Yeah,
I won't be
great.
like that woman and say, we'll tell you, don't marry somebody if they don't commit to.
Yeah.
I want to add one other thing. There's not a lot positive coming out of this pandemic, but one thing that I think could possibly be positive for women in careers is that all of a sudden there is a lot of attention to the requirements of family care and child care because of homeschooling, about women being home. The National Academy of Science, Engineering, Medicine just released a report last week before last, a report on COVID-19 and women in science, engineering, and medicine, taking a look at the effect of the pandemic on careers of women in these fields. And while this report focuses on those fields, I think you'll find they relate to women in whatever fields. Even if you're a housekeeper, if you've got to stay home and take care of your children because you don't have anywhere to take your children, it can affect your career as a housekeeper. It can affect you in whatever you're doing. But there have now been more articles and much more attention to the role, especially of women, because we know women are being affected much more than men. Although I had to laugh and I thought it was a good experience. We had a Zoom meeting of a committee meeting, and one of the top brass, this young man who was working from home, and he kept blinking in and out. And it turned out his son was doing homeschooling and taking over the Wi-Fi, so even he couldn't stay on the committee call. So he was experiencing what that was like. I think it made him much more understanding of what women have been going through. But women have been affected far more than men. And there was even an editorial in Science magazine by Evelyn Hammonds from Harvard calling for federal attention to childcare, to provide childcare, or we're going to lose more women from the workforce,
Yeah.
and especially women of color who are affected more so. So I hope we can turn this lemon into lemonade by getting more attention, although the minds of those in Congress on Capitol Hill. Don't ask me to explain.
Yeah,
But
that
let's
could
just
be a
hope
whole
they're
other
paying attention.
session, right? Of
That's right,
discussion.
another whole
Yeah.
session, yes.
Yeah, so I want to be respectful of everybody's time, but I have one more question. I wanted to go back to something that you talked about earlier and just get to give your final thoughts on. And you talked about, not thinking of it as vaccine hesitance, but what did you call vaccine?
Urgency.
Urgency, right. So how do you propose that we move from vaccine hesitancy to vaccine urgency, especially in the Black community?
I think I really wish early on more of us had been visible, getting the vaccine, going out and meeting in the community with individuals and not just dictating or lecturing them about the importance of getting the vaccine, but being available for questions, hearing what is behind your hesitancy. What can we do to help you overcome that? Look, I've gotten my vaccine. I didn't get sick, or I had a sore arm for 2 days, which I didn't, fortunately. To be able to say, look at us, we've gotten it. We are people of color, and we have gotten the vaccine. I knew some of those concerns early on, and when everything was being rushed, I was one of those that was arguing most loudly about how can I go out and convince people in my community to take this vaccine when I'm not sure it's really going through all of the trials that it should, and that it's really being developed with rigorous standards. And I have reversed that. And so I'm first to admit I had my concerns, but I have been reassured seeing seeing the trials and the data. And I know that Tony Fauci, whom I have worked with and worked closely, I can't that closely, but I was at NIH while he was there and have watched him over the years. And those at FDA, I won't comment on some of the political influence with the previous CDC, so that did not help. But knowing that they would not subject themselves, their families, or their communities, or any of us to anything that was not shown to be valid, efficacious, as well as safe.
Safe, yeah.
And the fact that I myself would get the vaccine, I hope will help to convince you to get the vaccine. And remember, once I changed my mind, I couldn't wait to get the vaccine, and I couldn't wait. That was the urgency. And I want all of you to do the same thing, because we have seen too much of health disparities in our communities, and we need to do something to protect ourselves. Too many people are blaming Tuskegee. That's not the major factor here. It is true, and I have written about it, that there have been cases where our people have been experimented on and where there have been mistreatment in the name of so-called research. But we've got rules, and we've got people paying attention now. And this is why it's important to have some of us in decision-making positions and in top positions, so we can make sure that rules are being followed and that our people are being protected. And therefore, you can have more confidence. Sometimes I think all the attention to what some people think might be keeping us or help promoting vaccine hesitancy is doing nothing but promoting hesitancy. So we need to talk about the positive factors and the fact that we can get together and you can have that grandparent hug, or you can have that birthday party or that wedding, if we can just get this under control. And that means each of us doing what we need to do in addition to the mask, getting that vaccine. And that's sort of my little mini speech. I could go on, but time is of too long. But I really think we've not done a good job. I mean, you hear all the talk and the panels and the webinars, but how many people in the communities are really seeing and hearing this? The best thing is one-on-one discussion or one-on small group discussions out in the community, making people aware and being able to respond to individual concerns and admitting when you don't know, but also being able to give examples of positive outcomes.
Yeah, you're right. I think, having the right information and valid evidence-based information, as opposed to buying into all the myths that have been flying around the community that people unfortunately believe, is important. So there's, I think it hasn't been widely known or made public that the mRNA vaccines have been around for quite some time. And so
Yes.
the COVID vaccine is just a derivative or variation of that. So it's been tested, and maybe the process was accelerated, but not rushed, and not necessarily circumvented just to get a drug or vaccine to market. So, but
And if you're going to be paranoid, maybe be paranoid that maybe folks are trying to keep you from getting the vaccine. So get paranoid in the positive way. Don't let them keep you from protecting your own health by giving you myths and misinformation, because look at the other folks, they're getting that vaccine and they're moving on.
Right. We see the disparity there in terms of the vaccination
Yes.
rates, not, all across the country, unfortunately.
That's right.
So with that, it's been such a delight talking to you and getting to know you and connecting with you, and finding all the common connections that we do have, in place, from UVA to growing up in Virginia, and me being born not far from where you grew up, and some of the other people that I'm sure we have in common, the more we talk and get to know each other. So thank you so much for agreeing to participate today and devoting your time and sharing your story. It's been great. And I want to, just make sure we leave with kind of your lessons. And I like your 4 E's, the equity, empathy, and ethics when it comes, and excellence when it comes to kind of leadership. So those are 4 key success factors, I think. And so just to wrap things up, we are, again, the California Black Health Network. We are launching the campaign for Black health equity to address the disparities and the fact that Black Californians, as well as across the rest of the country, have the lowest life expectancy compared to all other race and ethnicities, and COVID has only made that worse. So you can join the campaign and just email us if you're interested at askcvhn@cvhn.info, or you can go to the website or connect with us on our social media platforms. And with that, the only remaining thing I can say is thank you for being here today and taking time out of your busy day to participate and share in the discussion. So have a great day.
Bye. Thank you.
Bye. Bye. Thank you. Can you stay on for a second? Yeah.
Sure.
Gladys, did you end everything? Am I still mute? No. Oh, okay. So yes, I think that went really well. We had about 38 people who showed up. I think we had 50 something RSVPs. And most people stayed on until almost the very end. So that was great. So thank you so much. And don't forget to send your invoice when you